We've worked with Kingston General Hospital and Queen's University to develop and implement the Emergency Department Asthma Care Pathway. For people who land into the emergency department, it is a pathway that offers evidence-based practice and best care for people suffering with asthma.
What is the Emergency Department Pathway? Well, it's basically a document that provides some guidance for those providers that are going to be giving care to someone who might present to the emergency department with an asthma exacerbation or an episode. So when they first come in and get triaged at Emerge, there's going to be some specific things that they're going to look for with someone who has pre-existing asthma known to have exacerbations. They're going to be given some, medications, some typical bronchodilators or medication that opens up their airways, and there's also some other medication that can be used to bring down the inflammation inside their airways fairly quickly. Blow out to the end of a normal breath in your mouth. Release one puff. Now breathe in slowly.
The provincial asthma strategy began in approximately 2002, and one of the 13 initiatives that was funded was for the Ontario Thoracic Society of the Ontario Lung Association to work with partners to develop a clinical pathway to help guide the management of individuals with asthma who end up presenting to emergency departments with an acute severe asthma attack.
Not only is the treatment being highlighted in a pathway, it's also looking at the care that happens after they present to the emerge department. We look at important things like making sure the patient realizes what may have triggered their asthma and brought them into the emergency department at that time, making sure that they're able to take their medication properly with the best technique possible, because you can give someone as much medication as you want, but unless they have great technique with their puffers, they're not going to get the medication, and sometimes that can be the main reason why they continually have problems with their asthma. Plus, we try to provide some fairly timely follow-up care to make sure that they're getting better with what they're given in the emerge, and then making sure they have appropriate medication to continue to take afterwards. We have my asthma nurse practitioner clinic that I can usually see somebody within a couple of weeks of presenting to the emerge, and then we also have our asthma education center that provides more in-depth education, and it's based on what people already know about their asthma. So we're not just providing a cookie cutter program. It's really geared towards what somebody already knows.
Well, development of the pathway took a number of years, and it was very much a collaborative effort with many disciplines and individuals involved. And these clinician experts worked for many years to develop the clinical pathway and the tools that are part of the pathway. It went through a phase of developing, pilot testing, pre-testing, and then actually we were involved in leading a provincial study evaluating the impact of the tools and the pathway in a number of hospitals in Ontario. So why is this important to the average Kingstonian? Well, Kingston would be similar to the rest of Ontario and Canada in that its population a significant proportion of the population are affected by asthma. About 12% of Canadians, 8% of adults and 12% of children have asthma. Now, most times asthma is mild and can be readily controlled, but it's really important that all patients with asthma be aware that asthma can be life-threatening. And all patients with asthma need to have a clear understanding about what to do when their asthma gets worse, that individuals can die from asthma, and they need to know when and how to get help. And sometimes that might involve needing to know when to go to the emergency department.
See how you just kind of went with it? I want you to go like that. Great. Okay, so take a deep breath in. I think the benefit for the patient is that they're going to be treated with evidence-based treatments, so the management with the proper medication. It's also going to prompt some more education that's going to be done in the emergency department, and we do have the research to support that. The patients were actually able to recall the education, the information they were taught in the emergency department even after they left. So they're going to benefit from that, and also they're going to benefit from a referral to some specialized asthma services. So there was definitely an increase in referral rates to those specialized asthma services with the study. So I think that's the most that they're going to get out of it for sure. So yeah, the first one you did was at 4:30, so that was your highest, so that would be the one that you marked down. Okay. And you can just put down the time of the day that you do it, and that's great. Wonderful.
Lung health affects everyone. So for instance, on a day where you may have the smog is bad, the air quality index is at high risk, this will affect everyone living in Kingston and beyond in the areas. So lung health affects you even if you don't have a lung disease at home. People need to be concerned about their indoor air quality as well as their outdoor air quality, whether it be at home or in the workplace. When you can't breathe, nothing else matters.